so thank you very much for the opportunity to come here today and just give you, this really is quite a brief slide set. I've talked a few times in Scotland over the last month about the competition that we've got on. But what I'm going to do today is just outline the Technology Strategy Board's innovation platform. Switch on first, I remember I said that. Okay, so what we've been tasked with at the Technology Strategy Board is to make the UK the best place to develop a new era of stratified medicine. And really the aim there is to help accelerate the development and drive the uptake into use of stratified medicine and stratified products. The aim from the Technology Strategy Board is to help industry, because that's what we're tasked to do, but also we're obviously going to aim to improve patient outcomes and for the UK's wider economic benefit. Everything the Technology Strategy Board does is aimed at economic benefit for the country. So the programme we have is a partnership between these all of these groups. So the Technology Strategy Board, we're leading it, we're providing the Secretariat and a significant amount of money. We have the Department of Health and the Scottish Government's Health Directorate involved. They're driving the programme in terms of customer. We have the NICE, the National Institute of Clinical Excellence, who are providing the advice on economic benefit and uptake. And then we've got Medical Research Council who are interested in the science end, so they're on the biomarker side and the basic science, and two charities, Cancer Research UK and Arthritis Research UK. So together we're investing somewhere around 200 million over the next 4 years in programmes related to stratified medicine. We're all different, we've all got different aims and different agendas, but what we're trying to do is line everything up so that it all fits together and tries to pull products and science through to use. Last year we spent the summer in consultation, and we built a roadmap, a technology roadmap, outlining the key areas of interest within stratified medicine. And this, roughly in order of importance, were the issues that came up. So it's about incentivising adoption, increasing awareness not just from the medical end, but also from public side, looking at patient recruitment and clinical trials and how you handle the big data sets, and all the access and consents and ethics and all those issues around that side. There's a whole list as you go down, looking at biobanks, biomarkers. How do you validate a marker once you've kind of got the basic science behind it? And I think kind of Munir's going to talk about how do you take things forward into the clinic from some initial scientific validation. We've already run several rounds of competitions, and we've invested in the Technology Strategy Board, and we've invested somewhere around 10 million so far in the last year, looking at business models. We ran a competition alongside MRC, looking at access to patient consortia for inflammatory biomarkers, so we've got 4 programmes working there. We're working alongside Cancer Research UK's Stratified Medicine programme within tumour profiling, where we have funded companies to develop multiplex tests for use within the CIUK's programme and hopefully for rollout to the whole National Health Service later. We currently have a competition we've been looking at developing tests for adverse effects on non-responders. So that's an SBRI competition, so that's 100% funded. It's actually government procurement rather than collaborative R&D type funding. So it's a contract to develop products. We are getting a significant amount of interest in that, and that will close. That competition closes on the 13th of June this year, and we'll see where we go from there. And then we've got to decide what we're going to do next. So there are a whole series of potential activities that we've got on. We're looking at a grander scale health economic modelling and impact situation where we'll actually commission work looking at the benefits, and again some of the kind of background work will be discussed today. Possibly breast cancer, possibly diabetes. What we do is we tend to come out and ask you guys what you think we should be doing. So we're looking for industry to tell us what needs to happen. We'll be looking to build some kind of demonstrator system that will show changes. So we've currently got the Cancer Research UK model underway, and that's looking to drive change in the way molecular diagnostics are done in cancer. We will try and do a similar type of demonstrator in another area, and again we'll come and consult with people as to what that area should be, which ones are ready scientifically, which ones are ready clinically, and how can we help. We're also thinking about funding some kind of pre-competitive consortia work around the database and database generation, and also around biomarker validation for clinical endpoints. Large pharma companies have huge amounts of data from their phase 3 programs, on standard of care, that may be able to validate surrogate endpoints. However, when they go one at a time to the FDA or to the EMEA, they tend to get knocked down. If we can pull together all of that data and go together along with the kind of leading academics and make the argument, then perhaps we can get some of these endpoints validated, and then they can be used by anybody, including the smaller companies later on, to shorten clinical trials. We're also looking at things around imaging, where standards and adoption may be issues, and also things around reprofiling existing drugs. So that's kind of where we are at the moment. I'll leave it there, and I'll hand back to Rowan now, and we can get on with the real science.